Um, if there anybody in the audience would like to toss some, I already have a hand before I could.
So in the past, the government has got amazing campaigns, right? Like wash your hands, and they make songs like love chew, and then you grow up with that. You have campaigns for reading, yeah, like reading is good, or you have campaigns for polio, and now it's eradicated. So in my commoner's mind, I'm thinking, could there be a, okay, I'm shaking. Could there be a way to make a campaign on disability? Because, and this is something which a disabled comedian said once. He said, the problem with disability is how we look at disability. And he said there are two kinds of people, one who are already disabled or one who are going to be, either because of an accident or old age. And I was like, oh, that's right. So could there be sort of a national campaign on disability which could at least take care of some of the basic challenges and problems maybe, and then it can be built upon that? Or is that too backward thinking? Like, I'm not, but does that make sense to have a campaign to really change how we look at disability, how we can support it, and then things can be built on it, and then policies and everything can follow? Does that make sense? Thank you.
I think a national campaign would be fantastic. The question is, what do you solve? With a wash campaign, you wash your hands and you reduce, disease. So that's clean, the action and the solution. Disability is a fact of life. It's a part of being a human being. As you point out, we are or we're going to be at some point disabled in some way, right? So a campaign, a national campaign, perhaps to make that fact a reality would be fantastic, so that people stop having a oh no kind of attitude and say, oops, me next, I guess, right? That would be really nice. I think if I were to run a campaign, it would be don't be kind. Because she's heard this all the time, because all parents who work with me have heard this from me multiple times, is yes, we have a huge expectation from the society, from the government, from the hospital, from the professionals, where I'm not hearing any expectations of the person with a disability. Why? When is that going to happen? Why does the classroom teacher stand up and say, we have a child with a disability in the classroom, who's going to be her friend? Who's going to be a good helper? What? What is that base assumption? That we can't do anything because we have a disability? Is that how you want to raise your children? Right? So definitely a national campaign that helps reset the base approach about disability would be really helpful in just lifting how we think about what is this problem that we are solving, right? So that's my 2 pennies.
Convert from a moderator to a speaker again. So I would like to reiterate on this because we did do a nationwide campaign ourselves. With the support from UNICEF, we've been able to advocate on the national policy for persons with disabilities, as well as the UNCRPD, and then sort of like we just completed back in early November. It's we do it through a mechanism called disability equality training, where we involve the local leaders, the caregivers, district administrators, and we similar to this conference. But the beauty about this our advocacy through the DET is that all the conferences are carried out by the person with disability themselves, so that it's sort of like it's not a third person narration but first person narration. And then one of the most common responses that we get from the local leaders or anybody who hasn't been ordained or trained in disabilities, like, oh, we didn't know, I mean, we never thought about it. Even they could be one of the most learned person in the area or in the conference, and they are shocked to understand that disability exists, because quite often than not, most of them are in the communities, and then because of social stigmas and other barriers, they are hiding in the community. They're not empowered, so they can't come forward to talk about their problems. So I think the entire DPO predicates or forms around the idea nothing about us without us. 70% of our staff in the office are persons with disabilities. We have board members. 70% of the board members are persons with disabilities themselves, and we sort of become like the voice where collectively we um, campaign on the disability rights and inclusion. So, so to cut it short, I think a lot of times I think such campaigns have not happened, such advocacies or sensitizations have not happened, and most of them are at shock. But what they have promised after the DET session, um, unless they've been lying to us, there's going to be a lot of small interventions and innovations within the local gewok or the community, and then in the future they have a lot of plans of integrating those plans in the 35-year plan city. That's what we've been promised. Plus any. So okay, what we'll do is Madam Prashanti, then your follow-up question, and then Madam Sukila.
No, I just wanted to add, like, with regards to the campaign that you talked about, um, I would I love the idea actually to have a campaign to change the mindset, because you know there's one word I really hate. Can you guess what it is? Or a sound, or a word, or an expression? Exactly. I hate that. I'm like, when people come and like for example, my son, I like to call him a loafer. He's a big loafer. Okay, he likes to travel and go and eat, and then people are like the sometimes, especially when we are flying in, we can't fly Tashi Airlines because they don't have the ambulance, and we have to fly Trocair because at least they have the lift that takes them right up to the aircraft, and then we get to board first, and the air hostess says, "Oh, where's the patient?" I'm like, "He's not sick." And then they'll be like, "Oh, I'm so sorry. So I would like to see a campaign where we are changing perspectives and saying, like, people with disabilities are not there for you to feel sorry for, and then in the process feel good about yourself doing something to help these people, because you're just gratifying yourself. Look at the person with respect as somebody who can be as good, if not better than you at certain things. Like, I might be better than you at something, and you might be better than me at something, right? We are all so different. If we were to have a campaign, I would like to see that, and I would actually, as a parent advocate, like we say in Pensum, we will advocate for our children till the time they can advocate for themselves. And I would like to see positive stories, not just like, people with disabilities, they don't have that, they don't have this, we want this handout, so sorry, let's help. No. Let's see the positive things, the strengths that are there in them. Let's bring that out. So I would actually like to see a campaign happen along those lines.
Happen while you're traveling, get a traveling insurance. Do you see sometime in the future where we maybe have a disability insurance? And this will also solve a lot of problems, like save some money right now, because in the future you don't know who's gonna, like, in your family or yourself gonna be disabled. And then again, when it comes to respect, like when you make your own money where you don't have to beg, you have that sense of self-esteem and respect. Or is that too much of, oh my god, like to be too overthinking and be too overly precautious? Is that the word? What do you think that insurance industry around disability can look like? That's the final question.
Than a moderator, but then this is a real life experience. We did do a DET training for the financial institutions, and the idea behind was if they could come up with some sort of insurance like you were mentioning for parents who are working right now. And the idea could be very basic, like you have a child who has disabilities, and you know that the future seems very bleak because some disabilities are bedbound, they're severe, or what we call self-care disabilities. We have about 2.4% of people with self-care disabilities in the country. So what we wanted to do was, like, maybe the only insurance company life insurance company in Bhutan is RA Civil. So we invited them as well. And then we prompted the idea if there could be a life insurance scheme where the parents over their lifetime put a nominal amount of money in the insurance, and when sort of like when the parents are of when the parents have superannuated or retired or or have because of some mishap passed away, then the insurance ensures that certain monies are being transferred to the children with disability until their lifetime. So then, and then even the RICBL was quite interested, and they said they would explore the possibility of having such insurance scheme. And then we waited with a lot of hope, and I even shared to Madam Prashanti that I've been able to trigger an insurance scheme. But then it never came through. So I think the question now again needs to be asked to the insurance company what's going on, Sila. Yes, thank you. So with this, I will pass the question to Madam Stevie.
I also have a child on the spectrum who's a young adult now, 15 years old, so I want to be a bit of devil's advocate here. I think I want to put the register on the spot. I know you're also a parent, but you work in the Ministry of Education. So when you spoke about addressing inclusion in school through access and quality, I want to, not really like a question, but my observation. So my child went through the board exams and is now recently done his special board exam at the 8th grade. And at grade 6, when he was sitting for his board exam, the school asked, he can be exempted, he doesn't have to sit for it. But I insisted that he sit for the exam. And I said that he needs certain accommodations. And every time he sits a paper, and I asked him, how did it go? And he said, it was very easy, and don't worry, he calls me mother, so you say, don't worry mother, I'm going to get through. I said, how can you be so confident? And he said, the teachers taught me everything, So, that's not the kind of accommodations that we are asking for. So that's exactly the I and the tokenistic kind of perspective that we have. So I hope the ministry really addresses when you look at inclusion in school. Even now, teachers automatically sort of, again, not blaming or pointing fingers at anybody, but they sort of reduce their expectations out of children with disability, and they say, it doesn't have to, and it doesn't have to be set. Difficult question need not be, people need not be set.
We want them, I think the expectation is we want them to be pushed so they get to achieve whatever their potential is. So with that, it's neither like a question, but maybe something I hope there are teachers and educators in the audience here, so that that's something I hope you could keep it in mind when we look at inclusion. With that, maybe I'll pass it on to Okuma here.
Yes, good morning everyone. I'm Kamadoma Sringla from Save the Children, and I just wanted to first of all take the opportunity to congratulate the Bhutan Foundation and also DPOB for organizing this conference, and also for the wonderful projects. I think really Bhutan Foundation in this space, I think I equate it with innovation. So we need more of this in this space. For Save the Children, for the last 10-15 years, working for children with disabilities has been our key focus, actually one of our key focus. And I think as the panel members were speaking, we have been working with the Ministry of Health, with the Ministry of Education and Skills Development, also with the CSOs in this area. And I think for the panel, really wonderful discussion. There is so much that has been done, and there is still a lot more that we have to do, Mevala. And then what really struck me was Dr. Namita was saying that we have to really rethink how we provide services to Mewa Tamola. Not everything can be done by the community. The even we also have to hold our state accountable to provide services. So just want to maybe supplement any the health key discussion in terms of early identification and referral. Save the Children, we with support from the Lego Foundation, we had a project called with the Ministry of Health, project called Prescription to Play for more than 4.5 years. This project that covered the whole all the 20 districts and the services called by the Ministry of Health, C4CD plus NOLA. I think sir would be aware. So through that project deal, what we tried to do was strengthen the use of the Bhutan Child Development Screening Tool. So now this tool is part of the Mother and Child Handbook Imbala. And all the healthcare workers HAs are trained to use this screening tool as the first identification tool. What are the development delays that they notice? And then from the project day, what we added to that tool was what we call a play plan. So we proudly, when we talk about this project, we say that instead of dispensing medicine, now we also dispense play. So development delays notice the HAs were trained to provide also a stimulation plan because a lot of these delays can be, I think, helped by early stimulation. And then also, once if they see a red flag, how do they then refer to the BHU, the district hospital, and then to the regional hospital, and then to the national referral hospital where I think sir spoke about and where the actual diagnosis and treatment happens there. But our process, I was also discussing with Madam Nodu that we really need to have a good database, a registry system that can then be used to provide and link services there, be it health services, education services, or social protection services. So and then also Malaya referral baby, when we come to it takes a long time now. And most of these families, they cannot even travel to the district level, let alone to Pimpula. So but then for early identification, there is a nationwide BCDST and also a referral system in place. Yes, thank you.
I said I wasn't going to ask, but I have to ask really. This is fantastic. The conversation that I'm listening to is the conversation that I've heard in the US, in the UK, in Singapore, everywhere I go. These are questions that everyone is asking, and so you're not alone in these questions. These are the questions that everyone is dealing with. One question I did ask, and I think it's the chief of SEN, really, and I'm quite interested in this in my role as an educator at the university, is I might have missed this a little bit and I had to ask Mr. Google, but I believe there are development of early childhood centers that are happening across all of Bhutan. So I'm interested in the training of those professionals in early childhood centers with an interest in supporting children with SEN and disabilities. And that links then can from the hospital units into the early childhood centers, which they get in, because children are great. Children don't recognize disability, right? They're just children, right? And so getting children with disabilities into these early childhood centers is a way of breaking down that. No need for a campaign if we do that then, because children are children, right? And so I missed a little bit about what's happening in early childhood centers and the training within early childhood centers. Thanks very much.
Thank you so much for the question. Starting last year, looking at the transition from ECCD to primary education, we discussed in length that our ECCD facilitators to be trained to assess in terms of because they came up with so many issues. Many stated that many of the children have delayed speech. And then we said that not only with speech, they might be having some other forms of disabilities. So why can't we have training, assessment training using R&D kits? So with that, we have trained around 60 facilitators. Not only, I think, that's for government part. Even private are doing their best in terms of identifying the children with disabilities. And then we have Athang Institute, who is initiating all this kind of training for private facilitators. So that's how we are actually spreading how we can manage to assess our children so that they can be identified and proper intervention to be provided. And then even inclusive special education teachers in inclusive schools are helping ECCD centers to identify the children with disabilities. So this is what how we are doing. And now from coming year, we are planning to roll out the training to almost all the facilitators in the country, be it private or public. So this is what we are actually at the moment mandated. And then we are provided a fund. We have a fund from Indian government. We are allocated around 100 million to train our teachers as well as ECCD facilitators. Thank you.
I see so many hands at once, so I don't know which one to pick. Anyways,
Lasla, a very good morning and good afternoon to all of you here. For those of you who do not know me and my team here, we are from the private organizations. Me and my team, we work in the early childhood in Paro. It's Shari Early Childhood, Shari ECCD Center. For us, inclusive is very close to our heart. And for the past years, we have seen how this early intervention changes the lives of the children in the ECCDs. When children receive support at the right time, they get confidence. There are a lot of disabilities that we see in them, and then through one-to-one interaction and through face-to-face interaction and early intervention, we see a lot of confidence in them. Their speech is developed, and then the other physical disabilities or whatever they have, and that also improves their lifestyle, and the families also begin to feel very hopeful. So that's what we do in the ECCDs, and we try our best. Now, my concern here is just to ask the panelists here, and anybody can help us to set our mindset in a better way. We really wanted to be an inclusive ECCD, and then me as a proprietor or me as a operator of the private ECCD, we really wanted to make this culture in the ECCDs as an inclusive ECCDs. So my whatever I'm asking just now is, are there any guidelines or are there any requirements to be an inclusive ECCD? Because we really wanted to make it a culture to have an inclusive ECCD. So, we are doing a lot of things in the ECCD, but we haven't marked ourselves as a ECCD, inclusive ECCD. No. The inclusive ECCD is and guidelines, the requirements, so maybe anybody can answer. And then before I sit down, my next question is, my next thing is, all of us here are from the private ECCDs, and we are representing Bhutan Early Childhood Association. So what we have been hearing is, now the government, with the support and the help of the donor agencies,
A lot of things are coming on the ECCDs now. So our request and our reminder here is, please include the private ECCDs on Kishinabela.
Thank you, Chile. To establish inclusive ECCD, we have already have the standard set, and those standards will be very soon will be circulated to all the agencies. So we have already developed the standard. How should inclusive ECCD look at? Because we have already established 4 government inclusive ECCD. So honestly speaking, if you look at the government ECCD centers and the private centers, we can see so many differences in it, in terms of structure, in terms of play methods, in terms of how you deliver the curriculum. Yeah. So we have kept everything in our mind, and we have come up with the standard, so that I think this standard will support our private ECCD to come up with the inclusive ECCD. And then very recently we got a proposal to establish inclusive ECCD, which will be focused more on communication, speech. And then actually they wanted to come up with the services, and we said that it should go to health, not to education. And if they want to start with the inclusive ECCD focusing on speech, then it should be starting like a school. So these are the standards that we are coming up with, and then it will be circulated very soon now. Thank you so much.
More so, there is a guideline developed by back then the Ministry of Infrastructure and Communication. It's called guideline, infrastructure guideline for differently able. I think the jargon was used back in 2010. But anyway, emerged in ramp ki elevations, the anisukara detail, if for the engineers ki tani ki telu ani. Okay, next question.
Good morning, la. Thank you, la. Thank you, Bhutan Foundation and the Disabilities Kanila. I'm from Bhutan Stroke Foundation, but my question I would like to represent from the Bhutan Early Childhood Association as a private Gyanila. Me as a advisor for that association, I'm happy to see this Anila, my members here. My question to Doji sir again. It's good to know that lots of concern and lots of initiative. I have been working in this disability since 2014, like Prashante, and we had been crying for disabilities. But my wife also became permanent disabled after a stroke. So that's why, do you have, of course you said, you have plan and policy for the government, but to make it inclusive for the private, I can see lots of private ECCD right now in the association. We have 72 private ECCD across the country, and Paru itself have 9 or 10. Sorry, correct. Or are you going to wait for the government to set up? You are saying another 2 inclusive planning, but I have been hearing lots of proposals from the private ECCD, Shunibila, Shari, Nale, and Paru. And since I have been ambassador, I have authority, but I do not have. So, do you, sir, do you have any plan and policy to make it inclusive?
When we say inclusive ECCD, inclusive school, we're often really looking at structural inclusion. We're looking at the shape of the ECCD, the existence of ramps, the existence of supports. When you're talking about ECCD, you're talking about a 3-year-old child and a 4-year-old child. I would have no problem carrying a child into school. Many parents are carrying their bawling, screaming kids into school anyway, right? The problem I have is that once you've come up that ramp, anyway being pushed by your parent, and you reach your ECCD, your practices are not inclusive. That's the problem. That then becomes a problem. So I would any day weigh heavily on certification, the function, the actual function. Why do you have an ECCD? To provide children with a rich play environment. That's why I love what you said. A rich play environment, which often will reduce the impact of disability or impairment just because you provided such a good environment. I don't mind if I still have to pick you up and put you on a pod, I still have to carry
digital autism, which is concerning. We're not sure how it is caused, and we would like to know more about it. How is it caused? And is there any chance of getting permanent disabilities with this digital autism? So let's hear from you, sir. Thank you.
Joking, we always say that I am the father of virtual autism in Bhutan because I am the one who introduced this term in Bhutan. And I heard of this term, it's actually virtual autism. I heard this term when I was interning in NIMHANS, National Institute of Mental Health and Neuroscience, NIMHANS, which happens to be one of the biggest neuroscience hospital in India. So that's when my professor, they introduced me to this term, and that's how I introduced this term here in our country. Now, if I answer to such question, as of now, there is no proven research which says that early screen exposure definitely causes a form of autism spectrum disorder or ADHD or some other form of neurodevelopmental disorders. But then, what I, as a clinician, personally feels is that I can see a lot of young minds here, potential future parents. So I think it will be quite very informative for you all. What I personally feel as a clinician is that early screen exposure definitely causes some form of speech, language, or communication delays or disorder in young minds. And now, to understand how it affects, how early screen exposure affects the brain development and the stimulation of a child, I always go by the theory of language acquisition. Now, how we as a children learn language. Now, we learn language through something called as natural stimulation, wherein natural stimulation is that of a parent-child interaction and peer-child interaction. So this parent-child interaction and peer-child interaction is quite very important for language acquisition and development. But then in our current scenario, what is happening is this parent-child interaction and peer-child interaction is being replaced by digital screen time. And whenever a child comes to my chamber with a concern of speech or language delay, the first thing that I normally ask is, are you the parents? That is my first question. And normally, most of the time, they say that we are caregiver, parents, Australia, Canada, say. So by that, you figure out that the parent-child interaction is being restricted or limited. And the second question that I ask parents is, do you expose your child to screen time? And they say that yes, they do. And the follow-up question that I have is, since when? And most in our culture and context, it's that we expose the child to screen by 3 months or by 6 months, because for the private sectors, maternity leave gets over by 3 months, and for the civil servant, the maternity leave gets over by 6 months. Now, if you want to understand the adverse effect of screen time, what my professor in NIMHANS gave me as an example is that my professor, he came and he gave me and my classmates an assignment. So the assignment was, we were made to play Candy Crush. So we have this Candy Crush game on phone, and we were made to play this Candy Crush game from 8:30 a.m. to 12:30 p.m. So it's basically 4 hours of screen time. So, and he was like, okay, whoever has the highest level in this Candy Crush, I'll reward you all, he was saying. So as a student, we were quite very, it's free time, no? So we were just playing, and he arrived at 12:30, and he was like, now we will meditate and break for the lunch. So we were meditating. It was just 4 hours of uh, continuous screen time. I normally practice a lot of meditation, but then on that day, I couldn't concentrate only. I was just meditating, but then red, blue, green jelly were coming in my mind. Wonderful move. You have smashed it. Those sounds were coming in my mind. So it was just 4 hours of screen exposure, and my mind is, by then it is our Kusatagi mind, it's mature brain. So my mind being matured and 4 hours of screen time is affecting that much. Now imagine in children. So I was telling about the importance of intervening in the young age. 0 to 6 years is a critical period wherein most of the brain development happens. So in that period, if the child is exposed to screen time, and it's not like 1-2 hours of screen time. Usually it is like, when I ask how long do you expose in a day, they normally say like manye sen. That means child doesn't child is not exposed to the screen only when the child is sleeping. The rest of the time, let's say 15 to 20 hours of screen time a day. So in my clinic, I have like 5-year-old children who he'll be just singing rhyme, Baba Black Sheep, and the mother will pick and take the child to the toilet. Oh, he sings this Baba Black Sheep when he wants to go to toilet. So they don't know. Screen doesn't really teach you. YouTube doesn't teach your child that I'm hungry, give me food. That is the correct way of communication. Screen doesn't teach your child that. And there is one very good scientific study wherein they say that early screen exposure affects 2 areas of the brain. One is the GABA neurotransmitter, where the GABA neurotransmitter is the center of behavioral mechanism. So when the child is exposed to this screen time, they present with this aberrant behavior. And another area that is believed to be affected is a melanopsin expressing neuron. So this is a communication center. So when the child is exposed to screen, this melanopsin expressing neuron center is being disrupted, and that causes speech, language, and communication delay. So I like this. I will conclude with a very beautiful line that is often used by my boss, Dr. Ugindem. She is a child and adolescent psychiatrist. So long before, we never had something like marijuana causes schizophrenia. So it was believed like how it is right now, screen is believing to be causing communication disorder or autism. So in I think back in 2010 or somewhere, there was no literature which proved that marijuana causes schizophrenia. Now we have an authentic research which says that marijuana is actually causing schizophrenia. So I wouldn't be surprised to come across a study in another 5-10 years which states that screen is actually causing autism spectrum disorder. Thank you.
One last comment, maybe for the medical and EP. I think besides you, there are other colleagues also here. No? It's our observation that disability prevalence is higher in some region and low. We work in the Highland community, and I mean, like, it's not like the community is hiding, but in the Highland there weren't. I mean, like, I haven't seen a single. I haven't come across Sui Lingxi. Not a single child with disability. Maybe through accidents and all that there has been, but not neurodevelopmental disability. And we have been supporting health research programs and all that. And maybe it could be in the future you could do like a study on what causes neurodevelopment disorder, or has that any correlation with what you're exposed to the environment and all that.
Laszlo, in the interest of time, we would not be taking any more questions because some of us have another meetings, Manila. So again, I've never usually said this, but then the International Day of Energy, I also have a son who has disability, but like because it was very rare for him to find out. I mean, like you would look at him and intellectually and emotionally challenged to me. At the age of 3, 4, started having seizures. Then we like did brain EEG, brain MRIs, anything that's medically possible. But later on, through his blood sample, we found out that he has what a condition called Fragile X syndrome. So the Fragile X is again very unique, with some X chromosomes. Women have XX chromosomes, men have XY chromosomes. So that one of the X is kind of misbehaving, especially that happens more in men than in women. So the physical features is similar to Ula. They have like larger ears, and like fidgety hands, flat feet, actually sharp jawlines. Sounds like I'm describing a model, but not. They don't look so well, but nevertheless. Thank you so much for listening to us. I thank the panelists for their wonderful insight. They have gone above and beyond in expressing not just what's available in the facility, but also things they have, the aspirations, their own plans, and their own challenges that they have shared. But right now, what I need the audience to know is Toto Aluki Sauji email. So Madam Prashanti and I have Aluchi, for example, we have our kid who's born right now, has gone through medical screening, and then now it's almost being enrolled in a school education in Alula. After lunch, our kid will grow up, he will be skilled, he will go for employment, and then more interesting challenges and opportunities that, as of now, Bhutan has to offer for a person with disabilities coming soon. With a sumptuous lunch, we welcome you all for a sumptuous lunch, and then after that, let's see how the person with disability navigates through. Let's thank you, everybody.